Hello everybody, my name is Dr. Pieter Troost. I'm an ear, nose and throat specialist surgeon that delivers private medical health care to patients in Namibia and South Africa. I'm giving a series of talks to inform the general public about my work and the management that we give our patients to improve their quality of life. So today I would like to talk to you about a very common problem which is called recurrent tonsillitis. So there are two types of tonsillitis. The one, mostly in children, is where we get acute infections of tonsil infections that makes the patient sick, feverish. The child is feverish, very sore throat, and when the doctor or somebody looks into the throat, they will see the inflamed tonsils with little yellow dots on the tonsils. That is classically described as acute tonsillitis. The other form of tonsillitis is more a chronic tonsillitis, which is mostly in adults, although they can also get acute tonsillitis. But a chronic tonsillitis is something that just gives a constant discomfort here in this area. There's sometimes small yellow pieces that come into the mouth from the tonsil area, which is called tonsil stones. They have quite a bad smell and can give a bitter taste to the mouth and affect the freshness of the breath. And then also, as I mentioned, the discomfort that the patients or the adults feel in the throat. So the management of both these conditions are pretty much the same. The reason is that tonsils only have a purpose or function in the body from when you are born until you reach the age of 2. So the first 2 years of that small baby's life, the tonsils have what we call immunological function. So it helps and prevents the child to get infections and actually sort of have a positive effect on the child's health. However, after 2, following the age of 2, the tonsils have finished their work, and the white blood cells, the blood cells in the body called the white blood cells, they take over the management of the body's defense system. So the tonsils is not doing anything positive anymore. If the child or the person is just getting recurrent infections of the tonsils, also causing possibly sometimes sleep, when the patient sleeps, the child sleeps, snoring, that because of the blockage that the tonsils and the adenoids creates in the upper airway can lead to snoring, and it sometimes can be so severe that there is sleep apnea. That is where the child stops breathing at times, and which is not good for the general health. So when there's these episodes of tonsillitis and possibly airway obstruction, as we call it, upper airway obstruction, then tonsillectomy, or removing the tonsils and the adenoids, are as indicated. Usually there's no specific season, because there is like a myth that you should only do it in winter time or so, but whatever time of the year, with modern technology, modern science, there's no reason why the tonsils should be removed in a certain season. As I mentioned, the determining factor is if there's a history of recurrent problems and the person is older than the age of 2. The patient then comes into hospital, into theatre, after having the initial consultation with me, where everything is explained, is described to the patient. Then the patient comes to hospital, to theatre. A anaesthetist gives a general anesthetic, where the patient is asleep. Then through the mouth, we work with the headlight and we remove the tonsils and the adenoids. There are various ways and equipment to use that, so that's a bit technical, we won't go into that. But that is, the tonsils and the adenoids are then removed. Sometimes we use the opportunity to do a sinus washout at the same time. If the child has a problem with a bit of sinus problems, we also use the opportunity to take some blood for allergy tests at times, to just see if there's some allergy problems that can be managed in the post-operative phase, after when the patient comes back for the follow-up consultation. So this is done, the patient gets woken up, goes back to the ward, gets something to eat and drink, and most of the time on the same day, the patient can still go home. Recovery is generally quite quick for children because the tonsil areas are still small, so it takes generally 5 to 7 days for recovery. Adults, because the tonsils are bigger, it takes a bit longer. And mostly about 2 weeks needs to be given for recovery for the adult patient. So everybody, there's also a myth saying that the tonsil tonsils can't be removed in adults. That is not so. If a specialist, the ENT specialist, does it, then the procedure is pretty much the same procedure. The recovery phase, as I mentioned, is just a bit more prolonged. So this is the general background and information I think the general public needs to be informed about recurrent infections and tonsil problems and the way that we as ENT specialists handle this. So I hope that this will give you some empowerment in making decisions about your general health, and that we can create a happy patient and a happy doctor.